Meeting recorded.
Good afternoon, everybody. This is our annual CCP's annual Special Needs Plan Model of Care Provider Training. So the objectives are to gain an understanding and comprehension of CCHP SNP plan, to get an understanding of the elements of the SNP model of care, and training. You'll be able to describe the best practices for the MOC, which is what we call a model of care, and you'll be able to improve care coordination and member health outcomes. Specific standards set by CMS. The standards is that we have to provide this training annually to providers and staff. According to Chapter 42 of the Federal Code of Regulations, and specifically Part 4.2, it describes the requirement to train employees and contracted providers. Next, the is has to be re-credentialed every 3 years. There are 3 types of SNPs, or Special Needs Plan. SNP, institutional, and a dual eligible, which is also a DSNP, and that is the model which CCHP has. Members are eligible for both Medicare and Medicaid. It is a comprehensive plan for delivering integrated care. So CCHP offers a DSNP. Members have both Medicaid and Medicare, and the enrollees are responsible for $0 for all covered medical services. Slide. So C offers specific benefits that the unique needs of the population. We have services for member services. We have a medication therapy management program. We have a disease management program. We have emergency transportation services, holistic and complementary health services, community partnerships, particularly with Chinese Community Health Resource Center, or CCHRC. We have over-the-counter allowance, and we have flex card benefits. Next. So the DSNP model of care requires written documentation that describes the care management process and operations. It's required by CMS. Must be CQA accredited and renewed every 3 years, and CCHP received year approval. Actually, our most recent one was about 2 months ago. So in actual fact, we received the reaccreditation in 2022, would be good until 2025. The makeup of is a specific structure and domains. This domain is a description of the population. Number 2 describes the care coordination processes. Next slide. The number 3 is the provider network, and domain number 4 describes quality measurement and performance improvement. A total of 15 elements in domains. Next slide. Now, MOC model responds to CHP's mission and needs to service the appropriate community. We provide high-quality, affordable health care through culturally competent and linguistically appropriate services. CP provides, amongst other things, to frail elderly, high-risk individuals, low and low socioeconomic population, individuals with multiple chronic and acute health problems, individuals with or at risk of medication and treatment plan non-compliance, individuals without family support, individuals with limited English literacy, individuals with barriers to access to community resources and support. We for quality outcomes. We support PCP's plan of care, guide and support individuals to health and community resources. Next slide. The goals include the following: improve access to care, transition of care to reduce unnecessary emergency department and hospital admissions and readmissions, improve coordination of care, improve access to preventative health services, improve appropriate utilization of services, improve quality scores, improve satisfaction, improve health outcomes. Next slide. We have 3,050 beneficiaries. In Cisco, 96% Chinese. 25 to 101 years of age is the range. 60.7% of beneficiaries are between 65 and 80. 4.8% are women and the rest are men. Next slide. Care coordination. Care coordination facilitates effective use of resources to reduce the overall cost of care with improved outcomes. A single point of contact for the member across the continuum of care. The staff include registered nurses, social workers, and non-clinical coordinators. We work collaboratively with the member, family, and significant others, providers of health care, to implement the model which meets the individual's needs. Next slide. What are some of the care coordination activities include development of individual health needs, development of an individualized care plan or an ICP, identify barriers and strategies to address to get to the goals, personalized education, includes preventative care, post-discharge planning, educate on medication regimen, remember to access community resources and benefits, assist caregiver when member is able to participate. Next slide. The assessment, or HRA. It's good for each member enrolled in the SNP. HP administers them to all SNP members. It's a self-reported survey which includes questions on mental, psychosocial, cognitive, functional, and mental health. And an HRA is done in enrollment and every 365 days. Outreach is conducted if the response within 1 month of mailing date. It provides the basis for development of the care plan, and coordinators review the HRA and contact members for follow-up. Next slide. Of an HRA, and it deals with demographics, processes, community resources, medication adherence, etc. Next. ICP, an individualized care plan. CM regulates the requirement on ICP for each member. Responses are used to develop this ICP. Others, such as claims and labs, are also used. ICP is maintained and stored to assure access by all care providers and also meets HIPAA requirements. They include the members' healthcare preferences, goals and objectives, interventions and services, and the documentation is time-bound and must have certain goals to meet. It uses evidence-based guidelines such as interqual care guidelines. Next slide. So it uses the SMART measurable goal model. SMART being specific, M being measurable, A is attainable, R relevant, and T is time-bound. These principles upon which the ICP must be developed to make it a useful tool to follow members through to their goals. The ICP developed to address and manage responses and close preventive care gaps. Not respond to the HRA will receive an ICP based on claims and encounter data. The ICP document in the care management tool, which is ESET, HP uses a tool called ESET. It's updated with changes and minimal annually. The ICP updates and changes are communicated to the member, the caregivers, if appropriate, and provider or providers. Next slide. Of an ICP, and as you can see, it's quite a detailed document describing the members' baseline needs and goals. Next slide. ICP, they communicated via mail, fax, and secure email. Providers are asked to sign and return the physician care plan signature statement to our coordination department, each ICP. Slide. What is the Interdisciplinary Care Team, or the ICT? The Interdisciplinary Care Team may include, but are not limited to, member and designated representative, primary care provider, medical director, care coordination supervisor, nurses, social workers, medication therapy management pharmacist. Next slide. So the interdisciplinary care team the composition is determined by the member's needs, and CHP has from each of the categories mentioned in the previous slide. Member participation is encouraged, and the meetings are held regularly with clinical staff. In our case, it's weekly. Next slide. A little bit about transition of care. Care transitions occur, or transition of care occur when a member moves from one healthcare provider or setting to another. Example, member is admitted to the hospital and discharged to home, acute rehab, or skilled nursing facility. It would be a change in the member's setting, a transition of care. The member's plan of care is updated when there is a care transition. Primary providers are notified. Clinic staff assist the member to ensure appropriate follow-up care is arranged after a transition of care, and this may include helping the members make appointments, doing a comprehensive evaluation of their medications, etc. Next. So move on to our network providers, with one of the domains under the model of care. The network incorporates relevant information in the member's plan of care as to which providers are involved. Member network providers should follow the transition of care protocol and use evidence-based care guidelines. Annual review of delegated group utilization decisions and member appeals process. Medication therapy management program. Continue to improve the STAR and HEALS outcomes. Help the member improve the member experience measured in CAPS and HOS. Participate in the Quality Improvement Committee quarterly meeting. The Interdisciplinary Care Team, as mentioned before. Next slide. What is a provider? They play an integral part in the care team and a member to work with CCHP's care coordination team, take from the member's care coordinator, collaborate with the coordinator to address the needs of the member, review the member's plan of care, participate in the interdisciplinary care team, as I've mentioned before, and annual model of care training. Next slide. So how do care is mentioned in a separate domain in number 4. CC measures the effectiveness by utilizing standard measures, including HEDIS, utilization measures such as admissions per 1,000 ER visits, lengths of stay, readmission rates, experience as measured by CAPS and HOS surveys, and satisfaction with care coordination as mentioned by as measured by an internal survey. Next slide. CCHP SNP MOC needs to be your model on managing care for your patients. The model supports the mission of CCHP and its business objectives, and you providers are key to improving our members' health outcomes. Next slide. Finally, if you have completed this training, I would ask you to complete the attestation, which is required annually, as you are aware, in order to document that you have completed the training. Slide. We have a couple here. Important contacts, our coordination contact, as well as our provider needs or provider relations. Next. And thanks for completing the training, and we look forward to working with each and every one of you over the next 12 months. If you have any questions, please contact us at the contacts mentioned in the previous slide. Thank you and goodbye.